Hello and welcome. Today we are tackling a really important topic for anyone caring for someone with limited mobility, pressure ulcers. You might have heard them called bed sores or maybe by their medical name, decubitus. Now, they can be pretty serious, but here's the good news. They are almost always preventable, and it all starts with knowing exactly what to look for.
So, have you ever seen a reddish spot on someone's skin, maybe on their heel or tailbone, and you press on it, but it doesn't fade to white for a second? That little test, that spot of color that just won't fade, well, that's often the very first warning sign. It's the body's way of screaming, hey, something needs to change, right now.
So to really get a handle on preventing them, we got to understand what's going on under the surface. What exactly is a pressure ulcer?
At its heart, a pressure ulcer is damage, plain and simple. It's an injury to the skin and the tissue underneath, and it's all caused by too much pressure on one spot for too long. You'll usually see them over bony areas, places where there isn't a lot of natural padding.
Here's a really great way to picture this. Imagine a car is parked on a garden hose. The water can't get through, right? Well, that's exactly what's happening to the tiny blood vessels in the skin. The constant pressure squeezes them shut, cutting off the blood flow. And without that blood, the tissue can't get oxygen or nutrients, and it starts to break down.
So where are these high-risk zones we need to be checking? Well, think about the parts of the body that take the most weight when you're sitting or lying down. We're talking about the tailbone, the heels, hips, ankles, and even the sitting bones. The tailbone and heels are by far the most common, so make sure they're at the top of your daily checklist.
Pressure ulcers don't just appear out of thin air. They actually develop in stages. And this is so important. If you can catch them in that very first stage, you can prevent a whole lot of pain and damage down the road. So let's look at how they progress.
To really get a sense of how serious an ulcer is, they're broken down into 4 distinct stages or categories. It's basically a scale that tells you how deep the damage goes, from just a warning sign on the surface all the way to a deep wound that can expose muscle or bone.
Okay, let's walk through this. Category I, that's our red spot that won't fade. The skin's not broken, but it's a huge red flag. Then in Category 2, the skin is opened up. It might look like a scrape or a blister. By Category 3, we're going deeper, through the skin and into the fatty tissue below. And in Category 4, the most severe, the wound is so deep you might actually see muscle or bone. You can see why catching it at stage 1 is everything.
Now, listen up because this is incredibly important. That initial redness of a Category 1 ulcer can be really, really hard to spot on people with darker skin. So you have to become a detective and use your other senses. Feel the area. Does it feel warmer or maybe cooler than the skin around it? Is it a bit firmer or maybe softer? Ask if there's any pain or tenderness. These clues are absolutely critical.
Okay, now for the best part, the part where you have all the power. We've seen how serious these can get, but you can absolutely stop them before they even begin. Prevention is, without a doubt, your most powerful tool.
I just want you to let that sink in for a minute. You could have all the fancy wound care in the world, but none of it compares to just preventing the wound from ever happening in the first place. This is where you, as a caregiver, make the biggest difference.
So, what's golden rule number 1? It's simple. Positioning. Our bodies are not meant to stay in one spot for hours and hours. Regular movement to relieve that pressure is non-negotiable. It is the key.
So what's that look like in real life? Well, here's a good schedule to aim for. If someone's in bed, you want to change their position at least every 4 hours. If they're in a chair, it needs to be more often, at least every 2 hours. And little tricks, like using a 30-degree tilt when they're on their side, can take the pressure right off the hip bone. And always, always remember, lift, don't drag. That sliding motion can really tear at fragile skin.
Positioning is a huge part of the puzzle, but you also need the right equipment to help you out. And that's where support surfaces come in. We're talking about special mattresses and cushions that are designed to spread out the body's weight and reduce pressure.
Getting a pressure-reducing mattress or cushion can be a total game changer. And here's a fantastic pro tip for the heels. Just stick a pillow under the calves. That way the heels are literally floating in the air with zero pressure on them. Oh, and one huge thing to avoid, those donut-shaped cushions. I know it seems like they'd help, but they can actually make things worse by cutting off blood flow.
All right, our final golden rule is all about overall health. See, skin that's strong and healthy is just more resistant to pressure. And that strength comes from 2 places, from the inside out with good nutrition and from the outside in with good skincare. Think of this as your daily care checklist. First, skin. Keep it clean, use moisturizer if it's dry. If incontinence is a factor, a barrier cream is a must. And see this big do not here? Never, ever massage the skin right over bony spots. You can cause more damage. Then nutrition. Protein is literally the building block for healthy skin, and staying hydrated is just as important. These are some good targets to aim for.
Now look, even with the best prevention in the world, sometimes ulcers still happen. If they do, it's really important to know that treating them isn't some big mystery. Healthcare pros have a clear, structured way to help the body heal.
The goal of treatment isn't just slapping on a bandage and hoping for the best. Nope. It's all about creating the perfect conditions for the body to do its amazing healing work. Professionals do this by getting rid of any roadblocks, like infection or dead tissue, using a simple, clear framework. And that framework has a handy name, the time model. It's a simple way to remember what to look at. T is for tissue. Is it healthy or does it need to be cleaned out? I is for infection. M is for moisture. A healing wound needs to be moist but not soaking wet. And E is for the edge of the wound, our new skin cells starting to close it up. By looking at these 4 things, they can make a solid plan.
So as we start to wrap up, let's bring this all back to you. What's your role in all this? As a caregiver, you are truly the first line of defense, and your job can be boiled down to 3 simple actions: inspect, communicate, and act. Here's your action plan, nice and simple. Inspect those high-risk spots every single day. If you see anything different, redness, a blister, a sore spot, communicate. Tell a nurse or doctor right away. Don't wait. Prevent by making those golden rules a part of your daily routine. And finally, document. Just a quick note or even a picture on your phone can make a huge difference in tracking any changes over time.
I want to leave you with this one last thought. That quick 2-minute skin check that you do today, could it be the one thing that prevents weeks or even months of pain and difficult treatments down the line? It's such a small action, but its impact is absolutely massive. Thanks so much for joining me.